Good day, everybody. This is Chris with the Ancient Scholar, and today what I'd like to do is I'd like to review some drug profiles, and this is going to be a series of videos to augment what we've been covering in class, and this is going to be regarding OEM 207, section D01, that's paramedic pharmacology. So let's go ahead and begin. The first group of medications that I want to talk about are the so-called SSRIs. These are, of course, known as the selective serotonin reuptake inhibitors. These essentially prevent the reuptake of serotonin, also known as 5-hydroxytryptamine, or 5-HT, that's the chemical name of serotonin. And as a result of that, serotonin stays in the synapse longer, and there's a prolonged duration of action. And of course, there are a dozen or more individual receptors for serotonin, and we're not going to go into a detailed discussion on the receptors, but essentially, this is one of the mechanisms by which we believe we might be able to treat some people with some manifestations of certain disorders. And the most common indications for the SSRIs include treating depression. So these are classically known as antidepressants. Also treating anxiety or anxiety disorders, smoking cessation, and a few other odds and ends, but primarily mood disorders and smoking cessation are the common indications. And so if you are a paramedic taking care of somebody and you see an SSRI in their med list, these are the primary things you want to be thinking about. So let's just talk about some of the common side effects of the SSRIs. So the side effects in terms of antidepressant therapy are often fairly mild. And so they include the typical nausea, vomiting, diarrhea, headache. I mean, these are things that happen with placebo. Sexual dysfunction. Now, this may not be necessarily life-threatening, but certainly this can be life-altering, and it can alter the quality of life or impact the quality of life to the point where people find the SSRIs or the specific SSRI they may be on intolerable and quit taking it. So compliance can be an issue with some of these quote-unquote mild side effects. Insomnia is another common side effect as well. So just as a point to remember, oftentimes, in many cases, when we're taking care of patients, their problem might not be a primary medical issue, but it might often be the result of a side effect or an interaction with medications. So it is really important for us to appreciate the medications that our patients are taking. Some other things that we need to know about the SSRIs, they can interact with other medications, and specifically, they can interact with other serotonergic agents. Or substances. For example, dimethyltryptamine, psilocybin, monoamine oxidase inhibitors, the AOIs, which is a group we'll talk about in a little more detail, the cyclic antidepressants, the TCAs, for example. There is a risk for serotonergic issues if you concomitantly use these substances while you're on an SSRI, and the risk for something known as serotonin syndrome, which we'll talk about here in just a little bit, can be elevated. So that is something to know, and it is relevant when we're trying to obtain history physical exam of our patients. Some other things that we might need to be aware of: the risk for suicide. We often think about these medications used to help people who may be at risk for suicide, but in fact, taking an antidepressant, specifically the first several weeks that somebody is on an antidepressant, may actually increase the suicide risk. It may actually help give that person some energy, help them organize their thoughts to where they can actually develop and act on a plan. And so the suicide risk can increase, actually, in some patients, particularly reasonably early on, the first several weeks to first couple of months of antidepressant therapy. And alongside of that, there is perhaps an increased risk of violence in children. This is somewhat of a contentious debate, or contentious thing to talk about. I'll put a question mark there, but it does appear that in some children there is an increased risk for self-harm, harm to others, and violence. Children that are minors, that are non-adults, that are placed on antidepressants may actually have some special problems that can develop. Okay, let's talk about overdose, because these are common. These are very common medications. They're all over the market, fairly easy to get a hold of. Overdose is a relatively common thing. For the most part, it's often not fatal. Overdose is often not fatal. These tend to be reasonably well tolerated, and good supportive care tends to work well in many cases. There are some special considerations we'll talk about later on in this review. Okay, so one of the more concerning problems with these agents in the context of an overdose, as a side effect, or as a medication interaction, is a disorder known as serotonin syndrome. And this is a syndrome where you essentially have excessive serotonergic activity. And some of the signs and symptoms that we see altered mental status or altered level of consciousness. We can see tremors or myoclonus, as we have increased neuromuscular excitability that occurs. Excitable deep tendon reflexes might be a manifestation of that. Fever. These patients can develop a relatively high temperature. They can become tachycardic. They can develop diaphoresis. And they can even develop muscle rigidity in severe cases. And this can increase the risk of having a seizure, and in severe cases we can even go on to develop rhabdomyolysis, and there are renal complications as a result of that. So this looks very similar to a sympathomimetic toxidrome, but it is in fact due to an increase in serotonergic activity in the brain. So the treatment is going to be very similar in many cases to a sympathomimetic toxidrome. So rapid cooling is going to be important, particularly if they do have a markedly elevated core body temperature. A good supportive care support the ABCs, get a line in place, watch their vital signs closely. Benzodiazepines are going to be helpful in the management of these patients, and possibly, and this is somewhat contentious, but possibly a serotonin blocker, and the agent that is commonly referenced is something known as cyproheptadine. And in an overdose situation, if the patient is maintaining a patent airway and the overdose is relatively early in its time course, activated charcoal actually might be helpful. Again, there are some caveats that I just mentioned that come into play here. Okay, so that's serotonin syndrome. That's probably the most concerning problem that we run into with side effects or overdose situations. However, there are some special considerations that I want to talk about. And these special considerations, particularly in an overdose context, I'm going to talk about a few different agents. The first one is something known as citalopram. This goes by the trade name Celexa. We need to be aware that this has been known to prolong the QT interval. And anytime we prolong the QT interval, we increase the risk of a specific kind of polymorphic ventricular tachycardia known as torsade de pointe. So that's citalopram. There are an additional couple of agents that we need to be aware of, and I'll just put them up here. And these include the trade names Effexor and Cymbalta. Venlafaxine and duloxetine, Cymbalta and Effexor, and both of these can also cause a prolonged QT interval. In addition to this, rhabdomyolysis is more common with these agents, particularly in an overdose situation, and hepatotoxicity. In addition to this, these agents can act as sodium channel blockers. And so these can impact the QRS complex, cause a widened QRS complex, as it can block specifically the fast sodium channels that can impact the speed at which depolarization, particularly through the ventricles, occurs. And so they'll widen the QRS and further increase the risk of torsades and polymorphic V-tach and wide complex tachycardias in general. And so in this setting, administering sodium bicarbonate may be helpful to counteract the sodium blockade that we see with these two agents. And then finally, the last agent that I want to talk about in terms of special considerations is something known as bupropion or Wellbutrin. And this, as far as the SSRIs goes, this is really the nasty one here. Overdose of bupropion can be particularly nasty. This is also known as Wellbutrin, and this is commonly used to assist in smoking cessation. So it's fairly easy to get a hold of, but it is fairly toxic as far as the SSRIs are concerned, and so it can cause seizures, QRS prolongation or widening, rhabdo, hepatotoxicity, and so on and so forth. Really pretty nasty. How can we manage this? Well, we're going to manage it very similar to the serotonin syndrome patient, right, with good supportive care, as is the case with pretty much any emergency situation. Charcoal, with all of its caveats mentioned above, and charcoal might particularly be important if there is an overdose of a sustained release formulation, because the absorption is going to be so prolonged. Charcoal may actually have a really important role in managing that, so that's definitely something that you want to think about in terms of bupropion or Wellbutrin overdose. Benzodiazepines, of course, and if the seizures are refractory to benzodiazepines, barbiturates may also be recommended to control the seizures. And in some cases of severe refractory therapy, because bupropion is fairly lipophilic, and that is to say lipid-loving, there are some small case reports that lipid emulsion therapy or lipid rescue using 20% intralipid like we would with local anesthetic toxicity may actually have a role, and particularly in these really severely moribund patients where the standard therapies don't appear to be working. Sodium bicarbonate might be indicated as well, again due to the sodium channel blockade that can happen with bupropion overdose. So it's a pretty nasty one. And so these are the special considerations regarding the SSRIs. These are medications or agents that have, special toxicities associated with them. There's just one more thing I want to talk about, and we'll go ahead and end this review here, and that is on something known as drug discontinuation syndrome. So drug discontinuation syndrome occurs when somebody stops taking their SSRI, and this tends to be suddenly. It's not recommended. It's typically recommended if you're going to stop taking an SSRI, you taper, you taper down, and if that doesn't happen for whatever reason, there are lots of things that can happen here. So these patients can develop vertigo. They can get dizzy as a result of the vertigo. They can be lethargic. They can have nausea and vomiting. They have very vivid dreams that can develop. They can even develop paresthesias, numbness, pins and needles, and tingling in places where they wouldn't normally have that. Their mood can be altered pretty substantially in some cases. And it's just generally very uncomfortable for these patients, and they may not feel very good, and they may think something else is going on. In general, SSRIs with a short half-life, so short half-life SSRIs tend to be more likely to cause drug discontinuation syndrome. And in fact, the most common offender is paroxetine. This is also known as Paxil. And approximately 20 to 40% of all cases of drug discontinuation syndrome are due to discontinuing Paxil therapy. And I'm referencing any specific material out of Goldfrank's Toxicological Emergency 7th and 8th editions if you want to reference any of the specific material that I've presented here. You can sure do that in that textbook. Okay, so how do we take care of drug discontinuation syndrome? Well, for the most part, this is just going to be good supportive care, and then just recognizing, based on the patient's signs and symptoms and the history, right, getting a good history, getting signs and symptoms, and attempting to marry things up and developing a good differential diagnosis, actually just identifying that this may be on the list of differential diagnoses, passing that information on to the receiving facility, and hopefully facilitating getting this patient a proper diagnosis and proper therapy for their problem. Really important part of being a paramedic is not necessarily coming up with the definitive treatment plan, but actually putting things together and developing relevant differential diagnoses and then relaying that information to the receiving facility so with good continuity care, this patient can actually get a proper diagnosis and treatment. Really important part of what we do, but it's sometimes neglected for the more sexy stuff that is often associated with the emergency medical services environment. Okay, so that brings us to a conclusion of the common implications of SSRIs, SSRI therapy, side effects, overdose, special considerations. And this is, of course, in a more EMS-oriented context. Okay, I hope you enjoyed that, and we'll see you in the next video.